Dr. Baha, can you hear me? Hello? Can you hear me? Oh, okay. My internet is like frozen and now I'm on my phone because the Zoom logged me out. So like I'm taking the test and it's not going to the next question and it's just like frozen.
Go
So
back.
here,
Go back
okay.
and try
Like
to
I'm
go
trying to
further.
okay. Um, I try to try to like go back in. My internet's going like so slow and it logged me out of Zoom on my computer.
You
So
can
I'm like stuck.
don't push finish attempt. You can close and log again.
That's what I'm
Just
trying to do.
okay.
And it's still like loading, like
Okay.
my phone's
It's okay.
broken. Okay.
If there is no
Yeah, I
more
was
time,
like,
I will have you retake it.
okay.
That's okay. It happened.
I know, I was like, and then I got all freaked out because it like logged, it like took me out of the Zoom. I was like, oh no. Okay. I wanted still
You can
loading.
take the zoom out if your computer will works better without zooming. You can take the zoom out.
Yeah, I'm on my phone now because
You don't.
it
Okay.
wouldn't okay.
Do you guys have any question related to your test?
No.
How are you, Mrs. Sarah?
I'm great. How are you?
I'm doing good. We missed you last week.
I know I had a big day. I was getting married.
Ooh, congratulations.
Thank you.
No questions? Okay. We move on. Our next chapter will be related to the pelvic cavity. On the previous lectures, we talked about abdominal cavity. Also 2 weeks ago, if you remember, guys, I did talk about abdominal pelvic cavity in general, including the peritoneal membrane and the spaces. So for today, we're going to talk about just the organs and structure located within the pelvic cavity. So you need to know the delineation of your pelvic cavity, the muscles of the pelvic cavity, organ of the pelvic cavity, which is belong to the male and female. So we're going to discuss both of them. And then finally, you will need also to know a little bit about the blood vessels and the lymph system of the pelvic cavity. Previously, with Dr. Jacobus, you have learned about the bone in general. So we're going to repeat. And for this part, you just only need to know the name of the bone and the landmarks. This is of your interest. You do not need to go too much in depth, meaning you just need to look at this picture and you need to what? To memorize every single landmark. Those landmarks are important because are used by your muscles for attachment. So if you know the bone landmark, basically you'll make it easier on yourself to know the muscles attachment. So if you look at the hip region, what are the bones of your body that makes the hip region? The answer will be the innominate bone, which is this one. Also, sometimes we refer to it by coxal bone. So if I highlight it, you have on the right and on the left exactly like this, what we refer to it by innominate bone or coxal bone. And of course, if you look on the most posterior aspect, you are going to see another bone, which is represent the spine. Also, we did learn about this in the previous semester. So you have 5 fused sacral, and then 3 or possibly 4 fused coccygeal bone on the most inferior aspect. So one more time, your hip bone consists of right and left innominate bone, or you can refer to it by coxal bone. On the posterior aspect, midline, 5 fused sacral, and if you move more toward the inferior, it is 3 or 4 fused coccygeal. Those are part of the spine that you learn about it. To understand this image better, the top part is the superior and the bottom is inferior. and you are looking at it, mirror image, right and left. Make sense? Now, if you look at the innominate bone or the coxal bone, basically this bone consists of 3 fused bone, meaning those 3 bones, they do articulate with each other, but the type of the articulation is immovable. We did talk previously. In your body, you have 3 types of articular surface. Whether you use it to move specific part of your body, then I'm going to refer to this by movable articulation. Or you can move it, but not completely, meaning limited movement, like your spine. This is, we call it semi-movable. And then the other type of articulation, it's completely what? Immovable. And that was the example, the suture of the cranium, the sternum. The concept over here is the same. You have 3 fused bone. This is the first one, and we call it iliac bone. And then you have the next one, which is, you see it partially from here, and that will be ischium. All the way toward the anterior, you have another one, which is this one, and we call it pubic bone. So one more time. Coxal or innominate bone of the pelvis consists of 3 fused bone. Mr. Anthony, what are those 3 fused bone?
They are the pubis, the
blue one is the ischium or ischium.
Yeah.
And then all the way towards superior is ilium.
Ilium, okay.
Or the iliac bone. Ilium, ischium, and pubis. If you look at this, there is an articulation between the iliac bone on the superior aspect of your pelvis with the sacral bone. And I refer to this articular surface by what? Sacroiliac joint. So you have one on the right and the other one also where? On the left. If you go further, all the way toward the anterior, inferior midline of your body, that's the midline of your body, you will see another articular surface between the right and the left pubic bone, which is, I'm talking about this area exactly. And we refer to this by pubic symphysis or symphysis pubis. Same concept. Any question?
No.
You guys okay so far?
Yes.
Okay, just a little bit talking about the iliac bone. And let me go refer to this picture for a little bit, or we can talk about one of them. It's over here. So as we said, your iliac bone consists of 3 fused bone. This is the ilium. And of course, this is the ischium. And this is the pubic bone. You will need to know the landmark for each one. If you look at the ilium, which is the most superior, and the ilium has sharp superior margin like this, and that will be your iliac crest. So if you put your hand on your hip over here exactly, basically you are touching or palpating your iliac crest. If you move toward anterior, you will see a small pumped area. We call it anterior superior iliac crest, meaning this is the iliac crest. If I move toward anterior and I put my finger over here, this is anterior superior iliac spine. If you go to the opposite toward posterior, you will see what? Posterior superior iliac spine. Go further down from both anterior and posterior iliac spine, you will see the anterior inferior iliac spine and posterior inferior iliac spine. On the posterior aspect, a huge notch serves for the largest nerve of your pelvis, which is, we call it sciatic nerve, to pass. And of course, we'll go down in the lower extremity to supply your muscles. And we'll talk about sciatic nerve when we get to the lower extremity in detail. Between all those three bones of the innominate bone, you will see this cavity. And that cavity, we refer to it by the acetabular cavity. And the acetabular cavity, it's a deep cavity to receive what? The head of the femur to form the lower hip articulation. We'll talk about this also when we get to the lower extremity at the end of this semester. Meanwhile, between all those three bones, I have a huge cavity formed, which is, we call it obturator foramina. The obturator foramina, it is enclosed by a fascia. We call it obturator fascia. The obturator fascia, it is perforated for the blood vessels and the nerve to pass in and out. Also, the obturator fascia, it is used by some of the muscles of your pelvis to attach, and we'll talk about this in a little bit. Toward the posterior, where is the ischium, you are going to see a pumped small area, we call it ischial spine. If you go a little bit down, you are seeing pumped rough area. I'm talking about this. So it is not flat, smooth. It's a little bit what? Wavy, rough surface. We call it ischial tuberosity. The ischia tuberosity. For the pubis consists of two portions. This one is superior ramus, and this one is the inferior ramus. If I go back to the previous picture, basically, this is what I'm talking about. This is the superior ramus of the pubis, and this is what? The inferior ramus of your pubic bone. Correct? And of course, we said the right and the left, they join to form symphysis pubis. And of course, you are seeing over here the obturator foramina, over here the acetabular cavity, and then you can look iliac crest, anterior superior iliac spine, anterior inferior iliac spine, the ischium with the ischial tuberosity on the posterior aspect. So you are looking at the pelvis in this picture from the anterior aspect. A 3D CT scan for the pelvic bone with the same landmark, the one we discussed previously. As we said, your pelvic consists of ilium, and then the ischium, and then the inferior and the superior ramus of your pubic bone. You are going to see the articular surface between the iliac and the sacral, which is, we call it sacroiliac joint. So this is your sacrum, and this is your coccygeal bone. And if you guys remember, we said the L5 with the S1, when they meet, they do not meet straight perpendicular. They do meet with what? With an angle. And we call that angle sacral promontory. So if I ask you, Mrs. Sarah, what is sacral promontory? Your answer will be
It's the angle where they meet.
L5 and S1, the lumbar vertebra number 5 meet with an angle with the sacral vertebra number 1. And of course, we said this angle, it's used to use an imaginary line to separate the pelvic cavity from the abdominal cavity. Anybody remember that line? What's the name of the imaginary line? Extend from the sacral promontory to symphysis pubis. Ay, ay, ay. You forgot? Linea terminalis. Linea terminalis. So basically your linea terminalis, it's an imaginary line from here to here. Exactly. The obturator foramina on the right and on the left, and we said it's enclosed by obturator fascia and it's perforated for the blood vessels to move in and out. On the anterior aspect, you will see anterior superior iliac spine. If you go a little bit down, you will see anterior inferior iliac spine. The acetabular cavity used for the femur to create the hip articulation. This is the iliac fossa. The iliac bone, it's not a straight like this. It is what? With a small depression. We refer to it by iliac fossa. So those are the iliac fossa, exactly. The most sharp superior margin of the ilium, we call it iliac crest. The superior and the inferior ramus of the pubis, they meet with the other superior and inferior ramus from the opposite side to create the symphysis pubis articulation. Rough area on the posterior aspect of your ischium, we call it ischia tuberosity. And of course, your hamster muscles, when we're going to talk about it, they use this ischia tuberosity to start. If you move from the sacral promontory, let me make that. If I move along the right or left margin of the sacral promontory, this is what we refer to it by the arcuate line. Further, the arcuate line, it's in continuation with this line that we call it pectinate line. So I have pectinate line on the right and on the left, respectively. And I also have an arcuate line on the right and on the left, respectively. So if you look at that two lines together, they create what we call it pelvic brim. The pelvic brim. Your imagination, this is the way is the hip, correct? So from here to here is the brim. So I have portion of the pelvis toward superior and other portion of my pelvis toward inferior, and those we refer to them by the true and the false pelvis. And we'll talk about it in a little bit. One more time, you do not need to stress out with your reading. All what you need to know, the name of the bone, and as much as possible, if you can, memorize the landmarks. All those landmarks. You do not need to include the femur because we're gonna talk about them again next time. So if you go to the previous picture, this one, you can use that one. Also, you can use this one. Just the name of the bone and the landmark of that bone. So most of those bones will appear on our image, and you can see over here, they are showing you an axial cut at the level of the sacroiliac joint. In the midline and more toward the posterior, we said I have the 5 fused sacral vertebra, and they are going to articulate on the right and the left, respectively, with iliac bone. So this is the sacroiliac articulation on the right, and also this is the sacroiliac articulation on the left. So bottom line, this bone, the one you guys are looking at, all of it, from top to the bottom. This is the iliac bone. Another coronal cut also through the sacroiliac articulation, which is you be able to see the iliac bone on the right and the iliac bone on the left. And of course, the articular surface between them is the sacroiliac articulation. This is the S1, L5 margin. Where do they meet? If you look at the hip bone from the side, meaning you are looking at my hip from the side. So this is the way how this image taken. Basically, they are showing you the acetabular cavity, and you can tell the femur head fitting within it to create the hip articulation. So going toward up superior, you will see the ilium and the iliac fossa and the iliac crest. And if you go toward the anterior, you are going to see the anterior superior iliac spine. You go further toward inferior, anterior inferior iliac spine. On the posterior aspect, a little bit from posterior superior iliac spine, along with the sciatic notch. Great one, and this is the lesser one, and this is a pumped small area, which is we refer to it by ischial spine. You're going further down, this is the ischial bone. That's the pubic bone. Pubic bone is always oriented toward the anterior. And ischial bone, it's always oriented toward posterior. A rough area on the ischial bone, we call it tuberosity, and this is used by your hamstring muscles to attach. A coronal cut, but this is for only one side of the legs. And of course, most of those pictures will be repeated during the lower extremity chapters, because as you can tell, the hip articulation, it's part of your lower extremity. So I am going to have same pictures repeated again during the lower extremity. But for today, we care only about what? This area that belongs to your pelvis. So I am seeing from superior, moving down toward inferior, my iliac bone. And then the acetabular cavity receiving the head of the femur for hip articulation. As I said previously, to understand the hip or the pelvic cavity, flip a coin upside down. This is the coin. I'm going to flip it upside down. So basically, this is the way how your hip cavity. And you have the pelvic brim, the one I talked about it earlier, correct? And of course, your hip pelvic brim, consists of two lines that delineate it. This is the sacral promontory. So the line that starts from the sacral promontory, this is the arcuate line on the right and arcuate line on the left. A continuation further of the arcuate line will be pectinate line. That what we refer to it by the pelvic brim. Okay.
I have a question, Professor.
Uh-huh.
So the lines, they meet exactly in the middle?
Well, those are continuation to each other. I'm just doing
Okay.
those lines in two colors, so you'll be able to differentiate between the pictinate line and the arcuate line.
Okay.
See how this, they call this over here arcuate, and then
Okay.
further down, they didn't put arcuate. They put for you what? Pictinate
Okay.
or pictinal line, say.
Okay.
Now, if this is the level of my pelvic brim, that means your pelvis is divided from here, superior to the pelvic brim, and this we call it the false pelvis or the greater pelvis cavity. And then from the pelvic brim further toward down, inferior to the coccygeal bone, I'm gonna call it true pelvis or minor pelvis. So in this picture, I can show you, for example, this is your false pelvis or the great pelvis. Meaning, where is the true pelvis or the minor pelvis will be this one. Did you guys understand it? So if I cut that pelvis in two half, sagittal, like this, and you're gonna look at it from the side, that's what you guys are going to see. Only one half, and you're gonna look at it from the side. So this is the false pelvis. That's mean in different color, this is will be your true pelvis, or you could say major and minor pelvis. Meaning your false pelvis extend from the iliac crest superiorly to the pelvic brim inferiorly. Will be this way. From here to here. And your true pelvis or the minor pelvis extend from my brim to my coccygeal. There is a lots of organ that are located where? In your true pelvis, the small one. For example, Mrs. Ali. Mrs. Ali. Mrs. Ali. Mrs. Ali.
Yes. Yes. Hello.
Do you know that I have been criticized on Tuesday during my meeting with your director because of the actions of some of you guys? Your director, every time we record this lecture, she sit down and watch it. She told me this: it is insane. You are unable to control your class. Do you know why? Because some of you on the chat, other are on the phone, and other laying down like this on their bed.
Okay. I'm
It is
listening.
not okay, Mrs. Ali. Do you know why it is not okay? Guess what? I lost my raise for this year. This is what you cost me.
Me?
Sorry about that, Professor.
Yeah.
Yes, you, believe me.
That's
Believe me.
Yeah,
That's
that's upsetting.
you. Now, she watched that video. She will see you on the phone. This is what she's going to send me. There will be no race for you this year. I see anybody on the phone one more time, I will take you out of the class and I will mark you absent. Please. Okay? Next, this is what you guys are seeing, and this is what we talk about it. This is the small pelvis. And this is the large pelvis. What does separate the true and the false pelvis, Mrs. Ali? What does separate the true and the false pelvis? Tell her, Mrs. Sarah.
The pelvic brim.
This is the difference, Ali, between you talking on the phone and between your friend. Pay attention.
Oh, all righty.
Right? Okay. The pelvic brim consists of arcuate line and pectinate line. Correct? Mrs. Ali, you need to keep your camera on. We can't hear.
I was just about to type, say I'm gonna go to the restroom, so if there's no issue, that's why I'm not here. So
Okay.
when she checks, it's gonna be in the chat. That's why her thing was off. Okay. Thank you.
All right. Also, and you look in the sagittal, this is your, basically, I'm not gonna call this anything other than the linea terminalis, which is, we said, extend from sacral promontory angle to the pubic bone anteriorly. Also, if you wish, you can use the linea terminalis to divide the pelvis into true, false, and true. So the top will be false or major pelvis. The bottom will be what? The true or the minor pelvis.
Doctor, does it matter which terminology we use to refer it to as true or minor?
Doesn't matter.
Okay.
Doesn't matter. They're all concept. In your book, guys, they mentioned little stuff about the diameter of the true and the false pelvis. You do not need to worry about it, okay? You will not be asked. Also, this is for your own information. The diameters are used by the obstetrician during the pregnancy to determine the possibility of contraindication of regular delivery. So usually the obstetrician, in some ladies, they born congenital, their bone of their hip a little bit different. Like for example, this ischial spine in some ladies is a little bit what? That big, pump it that much. So the diameter will be measured from here to here. Other lady, they have narrower lip and hip than the other. So the obstetrician, they measure how much is the the major pelvis diameter, how much is the false one. Also, they use anterior to posterior measurement. There are a lot of different measurement, and then based on the measurement, if there's a possibility of complication during natural delivery, then the physician will choose to what? The C-section. Okay? You do not need to worry about those, even if they are written in your book. All what you need to worry about, the name of the bone and the landmark. And I want you to know the difference between true and false pelvis. Okay? In this section, they are showing you a little bit how you be able to use the arcuate line and then the pectinate line on the right, and also that will be applied to the left. So this is a part of your great pelvis, or what we refer to it by the false pelvis. And everything toward further down in this direction will be your true pelvis. Any question? Any question, ladies?
No.
That's all what I need to know about the bone and the pelvic cavity. Your next subject will be about the muscles around the pelvic cavity. And we're gonna start with those, the superficial muscles. So we're gonna go superficial and then we go deep, okay? The very first set of the muscles that are superficial basically represented by the gluteal muscles. And you guys know there are 3 gluteal, max, mini, and medium. Correct? So in sequences, underneath of the skin and the fat tissue of the gluteal region, you will see the great or the big gluteus, the max one. Underneath of it, the medium, all further, it's the mini. You do not need to read any of the above unless you want to. I'm not gonna ask you, but at least you need to know them in sequences so you be able to point on each of them. So if you look at this picture, the gluteus max start from the sacrum all the way extend to where? To my femur. If you want to see the other gluteals, you need to cut the gluteus max. So look how is the gluteus max covering what? Everything. That's your gluteus max. If you move the gluteus max, you will see the gluteus medium. The gluteus medium doesn't start from the sacrum. It starts from the iliac itself. So this is the gluteus medium. And it goes all the way to the same point with max. So all the gluteus, they're gonna end where? On the femur trochanter. On the femur trochanter. Underneath of the gluteus medium, you will see the smaller gluteus, which is the smaller gluteus start from here, like this. Also goes all the way down this way. So if you tell that the gluteus max covering all other gluteus, and the gluteus max, we said, start from where? From the sacral. Your gluteus max start from the midline, from here, and goes all the way down to my femur. In return, my gluteus medium start only from where? From here. And underneath of it, it's the gluteus mini. So each one cover the other. They are all having same action, which is extension of the hip articulation. So those are the superficial muscles of the hip region. If I remove all those gluteus, I am going to see another set of muscles. And those are located just deep to the gluteal, meaning you have to take all gluteal muscles, the max, the medium, and the mini. You need to take them out in order you to see them. The first one is piriformis, obturator internus, obturator externus, superior gemellus, inferior gemellus, and quadratus femoris. If you can remember them in order like this, will be the best for you. Why? Because in your body, after I remove the gluteus, in my body, I will see them in sequences. 1, 2, 3, 4, 5. From superior to what? To inferior. They are in sequences. So remember, those muscles are covered by your gluteus. And they are in direction from superior to the inferior. So if you remember them in these sequences, will be the best for you to what? to memorize them, and you can point on all of them in your imaging. Now, notable, look where all of them, they end.
Trochanter.
Exactly. So they all are going to end in the same area, which is the femur trochanter. Let me show you the femur trochanter on the bone to understand it better. This is the big trochanter of your femur, and this is the small one on the right and on the left. So those muscles, basically, they come from here to here in sequences, 1, 2, 3, 4, 5.
So they're thin bands. They're not wide muscles.
No, they are tiny. I can show it to you in the picture. Hold on. They are small. They're not big. Correct. There you go.
Okay.
So if I take the gluteus, including the three of them, the max, the medium, and the mini, I will see from superior toward what? Inferior, in sequences. That's the first one. Piriformis, superior gemellus, obturator internus, inferior gemellus, underneath of it, quadrate,
Okay.
and a little bit of obturator externus.
Doctor, do we need to know the origin also?
No. You
Just
don't
the
know.
order.
Just in order.
Okay. Do we need the
You remember-
action? No? Okay.
If you remember them in order, well, you just need to remember so you'll be able to point on them. Okay?
Okay.
When we get to the imaging, I will tell you, I will show you how to try to make it easier on yourself to point on those muscles. Okay? We'll talk about those. Do you guys have any question?
No.
No? The last 6 of the muscles are those that they belong to inside part of my pelvis. And those we refer to them by pelvic diaphragm muscles. Now, let me go back to one of those pictures of the bone to understand better. Okay, if you look at this picture, basically, are you able to see that hole? That's a hole, correct?
Mhm.
Or what we refer to it by pelvic outlet. So this is pelvic inlet, the entrance, and this is the exit of my pelvis. That's the way your pelvis. Let's take a female lady as an example. What do you have in here, structure, in your body? Can you name any structure, Sarah, in this region?
The bladder's in that region.
The bladder, if it's not full, by the way. When your bladder is full, after the 6-pack, your bladder goes all the way up to here. Okay. Another one will be the rectus, the rectum, or the uterus, the ovary. So everything are what? In this area, correct? Meaning, what does keep those structure in place and they don't fall down?
The muscles.
Exactly. What's the name of those muscles, Leticia?
The levator and the
Let's take them
coccygeal.
one time. Pelvic diaphragma muscle. Pelvic diaphragma muscles.
Okay.
Make sense?
Yes.
Okay. Now, to understand, I want you to imagine a female in gynecologic position. Do you know what do I mean with a gynecologic position? That's me. She is preparing for the delivery. So her legs supported like this. This is the leg, and this is what you see in between her legs, external genitalia, correct? Now, I'm gonna put my 2 hands like this. My 2 hands are what? The pelvic diaphragma muscle. So if I stand up, this female, so the uterus, the ovary, the bladder are where? In here. They are supported by this muscle. And if I put her in gynecologic position, That's what you're seeing. This is what between the legs. Also in this position between what? The legs. You guys get the point?
Mhm.
Okay.
Doctor, that's also called the pelvic floor. Is that what we're talking about?
Yeah, you could
Okay.
call it pelvic diaphragm muscles or the
The
pelvic.
pelvic floor. Gotcha.
Yeah, same concept. So what are the muscles of the pelvic diaphragm or the pelvic floor? Basically, there are two major muscles. The first one, we call it levator ani muscles, and the second one, we call it coccygeus. Now, the levator ani by itself consists of two muscles. One, we call it iliococcygeal. From the name, I'm saying iliococcygeal. That means this muscle extends from where to where? From the ilium to the coccygeal bone. The next muscle, we call it pubococcygeal. That means extend from where? From the pubic bone to the what? The coccygeal bone. Let's look at them on the image. To understand this image, please put for the top part is the anterior. And of course, this is the pubic bone. That means this is the coccygeal and the sacral bone. And that will be your posterior aspect. And of course, you are looking at it right and left. Correct?
Dr. Baha,
Yes, ma'am.
real fast, Janet wanted me to let you know that her internet went down. She's trying to get back on Zoom, but she hasn't been able to get back on yet.
Who?
Janet?
Okay. Sure. Can she hear us or no?
No, she said it kicked her out completely. She's trying to log back on, but it's not working right now.
Okay. Tell her that we're going to take 10-minute break until she logs in back.
Okay, thank you.
Take a 10-minute break.
Thank you.
back to normal. Mrs. Janet, are you back with us?
She was. I saw her logged on right before we went to break.
Yeah,
Yeah, I'm back. I had to reboot everything.
no problem. Did you miss too much?
I don't think so.
Okay.
It was out maybe like 2-3 minutes.
So we are talking about the pelvic diaphragm muscles, and we said pelvic diaphragm muscles consist of two major muscles, levator ani muscle and coccygeal muscles. The levator ani muscles consist by itself in two muscles. So looking at this picture, let's see your levator ani muscles consist of pubococcygeal muscles. So this is the pubococcygeal muscle. From the right and also from the left. And the second one, we call it iliococcygeal muscles. And of course, as we said, you can tell from the name, it has to be coming from the ilium to the coccygeal. Do you know why they call them levator ani? What's word levator ani means? What's pull your penis up. To understand those muscles, it's very simple. Look how those muscles are surrounding the tree structure in your pelvis and support them. Number one, the urethra. Number two, posterior to it is what? The vaginal canal. And number three, the anus. So what does support those three structures from anterior toward posterior in sequences? If you put the female in gynecologic position, so this is the way you see. Urethra, you go further down, vaginal canal. You go further down, anus. What does support them? The answer, the levator ani muscles. To understand it better, imagine yourself walking in the mall and you have diarrhea. What do you do to keep yourself without being embarrassed? Until you get to the bathroom, you are going to contract those muscles. You will contract them. When you contract them, you push the anus up, and the sphincter of the anus will what? Close until you reach where? The bathroom. When you get to the bathroom, the first thing you do, you will relax those muscles. When you relax them, the anus will what? Will drop down and the sphincter will open and enjoy the show.
Question.
Yeah.
Can you, is a person able to control their, for example, their ureter sphincter without flexing the levator ani muscles?
Well,
Do they always work together?
they are, but at the same time, you need to understand that you have two sphincters.
Right.
For the rectum and for the urethra, they are external and internal sphincter. Your internal sphincter is controlled involuntarily by the brain, but your external sphincter, it's controlled by what? By you, voluntary. So meaning, let's pretend you have a full bladder. When you have a full bladder, the internal sphincter from the brain stimulus will relax. But if you're not at the bathroom, what would you do? You are going to contract both the levator ani muscles and your external sphincter until you get to what? To the bathroom. You guys got the point?
Yep.
Okay. Not surprisingly, to understand it better, not surprisingly, a female that she has 6, 7, or maybe more kids, what will happen to her pelvic structure every time she gets pregnant? The muscles and the ligament that supporting the structure are going to what? Stretch, delivery, pregnancy, delivery, pregnancy, delivery. It's like a rubber band. What's going to happen to that rubber band? Stretching it and further will become what? Loose. That's exactly what happened over here. everything in here will become what? Loose. What's gonna happen? The rectum will be protrude through the anus. We call it rectal prolapse. The uterus will be protruded through the vagina canal, and we call it uterine prolapse. Bladder might be protruded also through the urethra opening,
Oh, wow.
and we call it prolapse too. So if those muscles, they get loose, what's gonna happen to the structure? They're gonna what?
Push through.
Protrude. And this is, we refer to it by prolapse. Of course, this is something can be corrected surgical, all right? But it might come back anytime, especially if you wanna get pregnant again. So the physician will ask you, is there any plan? If you tell them, no, I got 7, enough, I don't want more, okay?
So does that only happen, like, can it happen even when you don't have children, or is that only a consequence of having children?
Now, the most common cause is multiple pregnancy, but there are some ladies, they don't have multiple pregnancy, it just by nature. Accidentally, they have loose structure and they do have prolapse. You can think about it, anything will cause the abdominal pelvic pressure to what? To increase, will cause that possible problem. So if you have a chronic cough, bronchitis, you coughing nonstop for several years, you may end up with this condition too, because always the pressure of your abdominal cavity when you cough is what? Increased. So those muscles, when you cough, basically they are what? It's not that common, but it might happen. The answer is yes. Okay. And the last muscles for your pelvic diaphragma, which is, if you can look at it, it is the most posterior out of all the pelvic diaphragma muscles, which is that coccygeal on the right and on the left, respectively. So you will point on those muscles in sequences from anterior toward posterior: pubococcygeal, iliococcygeal, and coccygeal. Earlier, I was talking about 5 muscles, and I named the first one, the one underneath of the gluteal. The first one I said is what? The piriformis. If I have to put the piriformis muscles, will be over here. And then if I go more down toward posterior, you will see gemellus superior, inferior, internal and external obturatus, and then rectus femoris further down. So those muscles are where? Those muscles are inside, underneath. But the bottom one, those, the posterior one, are toward the posterior. Did you guys understand it?
Yep.
Do you have any question?
No.
No question. That sounds good. Again, they are showing you the pelvic diaphragm muscles in a different aspect. The way how I said this is the most posterior, which is the piriformis, correct? Those are the obturator internus. And if you go further toward the outside is the obturator externus, and so on. So your pelvic diaphragm muscles, the one we talk about them, are where? In this area exactly. From the pubic to the coccygeal. That's the pubococcygeal. And then the iliococcygeal. And then the last one, which is this one, is coccygeal. And those are the rest set of the muscles, the one we talk about them which is they are all the way on the posterior. So your gluteal muscles is covering this way, everything from outside on the posterior aspect. Other muscles also are included in the pelvic region, which is, we did talk about them last week, if you remember. And we said one of them, it is belonging to your abdominal cavity, but also it belongs to your pelvic cavity. And that was your psoas muscle. That's your psoas muscle. Your psoas muscles start from lumbar vertebral body and descend on the pelvic. When reach the iliac, this is the iliac bone. And we said on the anterior aspect, a fossa. We call it iliac fossa. Iliacus muscles is exactly fit within that fossa. So I'm talking about what? This muscle. This is the iliacus muscle. If you are able to tell that the psoas muscles and the iliacus muscles are going to emerge as one single muscle tendon, and that muscle tendon represent this. Ending where? In the lesser trochanter of your femur. And we refer to both of them at this point by ilio-psoas muscles. Make sense? Any question? No question? Okay, let's go to the imaging. If you look at this picture, this is a coronal cut. What is the best way and the best landmark to use to start pointing on the muscles? Bones are the easiest to see. So if I'm seeing the head of the femur, which is I will never lose it, correct? That's an easy. That's mean this is your acetabular cavity. And if this is the acetabular cavity, that's mean if I go toward up superior, this is the head of the femur with the acetabular cavity. I'm gonna go up. Which bone is that one? The ilium, correct? So this is your ilium on the right and also your ilium on the left. Now, which muscles from my ilium toward the outside over here?
Gluteus.
The gluteus muscles. So basically, this is what you are seeing, the gluteus muscles. That's the gluteus muscle. Correct? Now, which muscles located in the iliac fossa? So this is my ilium. The gluteus are over here. So if I move toward inside my ilium over here, which muscle am I supposed to see? The answer will be this one. Even if they did not name it, you'll be able to tell what is that. This is the iliacus, or you could say ilio-psoas. So it doesn't matter, you need to point. This is the ilium bone. Toward the outside is gluteus. Toward the inside is what? Iliacus. If you go all the way down toward inferior, that's mean you still have on the outside the gluteus, but if you go toward inside, you will see what? Obturator internus. Well, obturator internus mean inside. That's mean a little bit toward outside will be what? The obturator externus. Makes sense? Now, no need to know any of those muscles over here, guys. Those, they belong to your lower extremity, the thigh, okay? So you need to confine your study only for what? For this region. So later on, we're gonna talk about the organs and structure of the pelvis, and we're gonna name what you guys are seeing inside. But for now, I'm gonna point only on what? On the muscles, okay? This is an axial cut. Same concept. What is the best landmark? The answer will be the ilium on the right and the ilium on the left. If I go toward this direction outside of my ilium, what do I see? The gluteal, you see? For the gluteal, the largest one is the most superficial, which is the gluteal max. If you go toward inside, you will see the next gluteal. And then if you go further more inside, you will see what? The next one. So from outside, if you're moving from outside toward inside in this direction, you will name them max, medium, mini. If you want to start from the ilium, which is from inside, and move toward lateral, will be what? Mini, medium, and max. So the max is still coming this way, guys, but it's cut off in this picture, correct? If this is the ilium bone or iliac bone, and those are the gluteus, that's mean if I move in this direction toward outside, first muscles to see is iliopsoas, the iliac fossa, correct? So you see it from the right and on the left aspect. Now, you guys learn the rectus abdominis muscles, which is represented by your six-pack. This is what we talked last week. The rectus abdominis muscle extends from here to here. That's mean when I cut at the level of the pelvis, I will still be able to see what? The two band of your rectus abdominis muscle, correct? This is Janet. What is this?
Linea alba.
Absolutely. The linea alba. Any question?
Can you point to the linea alba again? I couldn't really see.
The red one.
Okay, cool. Sorry, I was like,
Well, linea alba is the line, midline. This is the linea alba.
No, I know what it is. I just I couldn't see your little clicker, so I was like, what did he highlight? So I just wanted to see
okay. That's okay. Now, if this is the pelvic region, what is the most posterior muscles on my pelvic region? Is going to be those 5 muscles, but at that level, I'm at the superior aspect, so I will see only what? The piriformis. So if I go further down, I won't see piriformis, I will see possibly obturators or possibly the gemellus, etc., etc. You guys get the point? An axial cut, also at the level of the pelvis. So your bone is always your landmark. This is my iliac bone. And this is my sacral bone. And the articular surface between them, we call it sacroiliac joint, correct? So which muscles are located toward outside of my iliac bone? Lizette.
It would be the gluteus maximus medius. And
exactly. So I am pointing on the gluteus. Now, which muscle is located toward inside of my iliac bone?
the psoas iliac.
The iliacus and iliopsoas. So over here, they name it iliacus. You can call it, if you wish, iliopsoas. Same. Because we don't know if the level of the cut showing us the emerge of the 2 muscles or only one, but doesn't matter. All right? So, meaning they point on this as what? The psoas. So further down, those 2 are going to meet in here, and then you're gonna call them iliopsoas. Correct? I'm still at the level above what? The symphysis pubis. You see, this is the symphysis pubis. This is where your rectus abdominis muscles end. Your rectus abdominis muscles start from the sternum Xiphoid, go all the way down to my semiphysis pubis. If the cut is above it, that means for sure you are going to see what?
Rectus abdominis.
The rectus abdominis. And Mr. Steve, this area line between them is your linea alba.
Oh, I thought you were gonna ask me. I was all ready to tell you.
No, I'm not asking you. I'm making sure that you get it.
Yeah, thank you.
Uh-huh. Make sense? You guys okay? This image also axial, but they are showing me only one side. You get that? Only one side. So what is the best landmark? Same. If this is the head of my femur, that's mean this will be the hip articulation with the acetabular cavity, correct? So this way is my ilium, and if you go further toward anterior is my pubic bone. So toward this way, posterior is my iliac, and toward anterior is my pubic bone, correct? So at that point, I'm still using this iliac bone, a landmark to point on further structures. So let's take what is toward the outside of the iliac bone is my gluteus. So those are the gluteus, guys. What is toward the inside of my iliacus on the right and on the left? Obturator internus, and this is the other obturator internus. Both of them. Correct? The gluteus are moving all the way. Why? Because the gluteus, they move this way. So from posterior toward the lateral. Not only on the posterior and lateral, your gluteus. Your gluteus are not 100% here. They are a little bit also where? Lateral and posterior. Make sense?
Yep.
The top muscles, you do not need to worry about them because those are part of your lower extremity. So you will not be asked about them in next quiz. And we will talk about them when we get to the lower extremity, guys, okay? So this is the superior ramus of your pubic bone. So going toward more posterior will be the iliac fossa and the iliac bone. And that will be your iliopsoas. Also an axial cut, but this cut is just at the level of the pubic bone, meaning if I'm moving from anterior all the way toward posterior, the first thing I will see what? Rectus abdominis muscles. I'm still be able to see because the cut is above the pubic bone, guys. As long as you are cutting above the pubic bone, that means the rectus abdominis muscles are in your screen. And of course, the area that they connect is the linea alba. Now, going toward posterior, meaning this is my rectus, and I'm going all the way toward the posterior. That's mean I'm supposed to see what? My gluteus. So all the way toward the posterior are the gluteus, right and left. Correct? You move further at this level from the gluteus, you are going to see another muscles, which is coccygeal. You move further toward anterior, so you're still inside, you are going to see obturator internus, and then the obturator externus. You go further more toward anterior, you are going to see some of the muscles that start and they act on your lower extremity, and they are none of our interest. Okay? You do not need to know them. They showing you the levator ani muscles on the male. So earlier when I was talking about levator ani, I always referred to the female because it's easier to understand. But does the male has a levator ani muscles like a lady? The answer is yes. Male pelvis structure also need to be supported by those muscles. So the penis and the anus always in the midline toward the body. And of course, if I'm going from anterior toward posterior, I will see the penis first, and then if I move more toward the posterior, I'm gonna see the anus. Now you're gonna use those as landmark. If you go toward this side, right and left respectively, the first muscles you will see, obturator, internus. You go more toward outside, the obturator, externus. The starting of the pectinate muscles, which is belong to your lower extremity, and you do not need to worry about it for now. If I move more toward the posterior, that's mean that will be my gluteus. Now, if you look at the map, the cut is below your pubic bone. This is why you are not seeing any what? Any rectus abdominis muscles at that point. Now, levator ani muscles, which is our interest in this picture, you're supposed to point on them on the area where they're supposed to support my middle structure in my pelvis. My midline structure in my pelvis is what? Here. So those are the levator ani muscles. By the way, the levator ani muscles are pretty much tiny, guys. They are not thick. They are very tiny. They are like my finger. They are just like my finger. So you will need to refer to them where? Right and left to your genitalia and the rectum. So in the female, they are going to be what? Same concept? The answer is yes. It is obvious. This is the midline structure of the lady. So this is what I am seeing. Urethra, this is the urethra. That's the vaginal canal, and this is what? The anus. You guys remember in sequences from anterior down toward posterior. Urethra, vaginal canal, correct? So to